Welcome back to The Circle, everybody. This is Timothy Bish, and I'm here with Jeffrey Schaffer, a registered nurse and program manager of TestNtreat here in Provincetown, Massachusetts. Welcome back, Jeffrey. We are starting a series of short segments where we talk about queer health in this political moment. And so earlier this week, I was on Instagram and I saw a post that indicated there was going to be restricted access to PrEP for queer people. And this immediately made me nervous and made me wonder what was actually happening. I did a little bit of Google searching. I couldn't find the answer. And so what I ended up doing was calling my doctor, asking some questions, and then going in for my 3-month checkup where I got to have a conversation with Jeffrey. So it became clear that there was a lack of clarity around what is actually happening. So today we're just going to talk briefly about what is happening for access to PrEP for queer people. What can queer people do in response to this potential action? And what are the potential consequences for TestNtreat, such a vital service that exists here in this safe space of Provincetown, Massachusetts? So, Jeffrey, if you could start, what's going on?
Oh, gosh, a lot. I mean, what you probably saw might have been a reference to the Braidwood versus Becerra case that's been at the Supreme Court has agreed to hear the case. Or it could be a article about what's happening with USAID and PEPFAR over in Africa. And so there are sort of two big things kind of going on with PrEP right now. The first one, just real quick, with the PEPFAR mainly has to do with Africa. It doesn't really spill over into the U.S. at this point. And so it is a horrible situation over there. But it's one of many horrible situations that the decision has led to. And
well, to be clear, it can potentially negatively impact queer people in Africa, but currently may not have a direct impact on queer people here in the States. Did I hear you correctly?
Yeah. So what's going on in Africa is way more global than just queer people, and so it's everybody who's affected by HIV and AIDS in Africa or at risk for those things in Africa. So that's definitely not a great situation. Now, with the Supreme Court case, I was just as confused as everybody else. So long story short, with this case is there's a determination about a grade A or a grade B rating given by the U.S. Preventative Services Task Force. That's the group that says that you should get a flu shot every year. And we don't want that to be we don't want that flu shot to have preventative costs to it. Meaning, if you have a high deductible, if you have insurance, your insurance will provide that at no cost to you, no cost out of pocket. So you can get a flu shot, and it's not going to cost you anything. There's a lot of different preventative services that fall under that grade A and grade B rating. So PrEP was given that rating a few years ago because it's 99% effective as long as you take it. So insurance companies not so happy about paying for those kind of things. And then also the Braidwood versus Becerra case had to do with a religious organization who didn't want to pay for PrEP under their insurance because it didn't align with their religious values. So it's gone through a few different decisions. Right now, it hasn't affected globally, or not globally, but nationally programs. With this case going and them agreeing to see it or agreeing to hear the case, and with some of the decisions that the court has made in recent years regarding people who are at risk for different things, everybody's nervous about this. They went at it at a different way, saying that the people who decided these things should be preventative, or that they're grade A and grade B don't have the authority to do it. And so it's more of a technicality they got around it. It wasn't really about PrEP. It wasn't really about this. So they got it sort of on a technicality. Unfortunately, that may have implications for other preventative services like cancer screenings and diabetes screenings. There's about 30 other things that are probably more that this can affect in regards to preventative health measures. So a couple different things can happen. One of them is that they uphold the current mandate, meaning that insurance companies will have to cover it. Best case scenario. They can do a partial rollback, maybe maybe they might be able to sort of carve out certain things like, is it just going to be about PrEP? Is it just going to be for religious organizations? And the other part is they could do a complete overturn, meaning that they don't have to provide these services, and it expands to other services besides just PrEP. And then, as I already mentioned, they could do the religious exemption part. So those are, the best of the worst case scenarios. I think what's important to know is that if this decision is made in June, that nothing will probably happen right away. And part of that has to do with the fact that this only affects commercial insurance plans that are covered under the ACA. So if you have Medicare, Medicaid, it doesn't get affected by this. Now, the other thing is, when you sign up for commercial insurance in open enrollment or wherever in November, December, you agree to a plan that's for the entire calendar year. So it's rare that they will say, okay, this is going to be in effect immediately. So if the worst case scenario happens, we're probably going to have 6 months to figure out a plan. Because the insurance companies can't really redo the policy in the middle of the year.
Okay.
It might be something where I would say if it was a religious organization thing that they decided to carve out, they might have an ability to do that. But this is just me guessing.
Yeah.
And so we're going to have some time. I think the other thing that gives me a little bit of hope is that if this were to affect something like a flu shot, there's something in it for insurance companies to cover a flu shot. So I believe that there's something in it for insurance companies to cover PrEP. So especially if you're on, a generic low cost version, then everything's about money, right?
Yeah.
So everything's about money.
Like what is more affordable, preventative care or treating you through like whatever it might be. And this also feels like another example of how it initially can feel like an attack on an individual group, and how that attack can then have a ripple impact to so many people. So when I think about cancer screenings or other sort of very necessary medicine, sometimes if you think you're attacking PrEP because you're attacking queer people, you may be having an unintended impact or implication to what you're doing. So as we talked earlier, sounds like there's a lot of possibilities that might happen, and that the immediate impact, especially here in the States, isn't going to be like an immediate removal of our access to this medicine. But what should we be doing from your perspective to prepare ourselves for what seems like an ever-changing political landscape?
I would say in regards to PrEP and other things is just to, while everything is good at this point, stay up to date on your healthcare, and so like, have you
welcome the new segment on The Circle? Yes. Yeah. Staying informed on what's happening. And as we talked about in the previous episode that you and I and Eric did, ask the right questions, which I was fortunate enough to have someone like yourself answering these questions to provide clarity that I couldn't find on my own.
Right. And for the most part, if I know, speaking for us and our organization, if you have questions, you can reach out to your provider, plus also, a lot of stuff is online, and so you can phrase these things in the question. That's what I did kind of with this one. I said, I go, what are the possible, I put into, a search engine, what are the possible implications of the Braidwood versus Becerra case? And it came out with lots of great resources, and put them into a succinct way that I could understand them, since I'm not a lawyer.
Yeah.
And it also gave me those. Now, the other things, like the reassurance part, that was stuff that I just know. And also, there's an organization called PrEP for All, which is really great. You can look that up online. And they actually, that's another good thing. Go to PrEP for All. It's PrEP for the number 4 all. And then they're looking for stories that they can add to the case. So when it's argued in front of the Supreme Court, that that they'll have actual cases, in front of them. And so There's things you can do instead of just sitting and waiting for doom. You can look into some of this stuff, and then also keep up on your healthcare. So if you were to, let's say on June 15th, no PrEP for anybody. Well, okay, so if you've gone and you've gotten your supply beforehand, do you have a certain supply? So, those kind of things, obviously short term, worst case, but I am hopeful that because there is a financial benefit for some versions of PrEP and insurance companies, that it's not going to be the worst case. But I don't know for sure.
Well, and so speaking of that then, with potential outcomes, so Test and Treat service here in Provincetown is so important and so vital. So my final question to you for our short segment today is simply, what's happening with Test and Treat? Do we need to be concerned about whether or not it's going to stay? Will it still be available to us? Like, what do you know in light of what's happening?
As of February 16th?
That's right. That's right. Yes. Yeah, because it can change. But what do you know right now, with the understanding that we could come back in a week and have new information?
Right. Right now, we're fine. I think that there's I will be sounding the alarms when I feel like our program is in danger. Test and Treat was developed before the decision that this case is about was around. So I kind of look at it as there were difficulties before getting PrEP. There are still difficulties getting PrEP.
Yeah.
My job is to help people navigate those, whether they're ones that already exist or ones that are going to happen in the future.
So I'm curious because in other situations, we've noticed that then sometimes these decisions become state by state. So I'm just wondering if a visitor to Provincetown is coming from a state, and if something were to change and they don't have access to it in their state, can they get access to it here from our clinic?
Yes.
They can?
Yes.
So this could be a beacon of hope and light,
yes,
if it were the case. But right now, that isn't the case.
Yeah, if people are visiting from another place, I don't care if it's for a day, a weekend, the summer, or for the rest of your life, they can come see us and they can access PrEP. There are, obviously, if they have certain medical things that prevent them from that,
sure,
there's always a big asterisk.
Sure.
But with PrEP, it's a small asterisk.
Yeah.
I challenge anyone to come to me and not get it.
Well, this is a great example of like Provincetown, again, being a safe space, an inclusive space, a space where we are all welcome, one that we are trying to make, increasingly inclusive and safe, and especially in this particular moment. Jeffrey, thank you so much for coming in. Hopefully we'll do a series of these because I know that there are a lot of queer people like myself who are worried about what might be happening. And with living busy lives and with the speed at which things are happening, it is helpful to have people who have an insight to give me even a little information. So you've done that beautifully. You did that when I was in the clinic with you, and you've done it here today. Speaking for myself, but for all the listeners, thank you for everything. Because I suspect even if I knew everything that you just said, it's helpful to hear it put another way and said a different way. So thank you so much for coming to the circle. Let's do our best to keep our queer community safe and healthy.
Yeah, it's my honor to serve. Thanks so much for asking me.
Oh, thank you for being here.